everybody, this is Dr. Unati. I just thought I should hop on here today to make a short video on World Cancer Day. Today is World Cancer Day. I just have two types of cancers that I want us to explore today: cervical cancer and prostate cancer. Cervical cancer, I'm going to talk about it because it affects a lot of people in the middle income countries and also low income countries. Of course, it affects people globally. So who is at risk? Basically, you're at risk if you have multiple partners, you started sexual activities at a younger age, or you are a smoker, or probably you use birth control. Studies also show there's some hereditary effect, or girls that are married to older men. You know, there's some kids in Africa or even other cultures in Asia who are married to younger kids. They basically have a higher risk. So how do you present when you have cervical cancer? Cervical cancer, the risk, as I said, it's the above mentioned risks, and basically you get infected with Hpv, which is human papillomavirus. It is a sexually transmitted infection. People that are at risk is anyone who is sexually active. You basically get infected with this virus and it changes your cervix. There's so many subtypes of this virus. It can also cause genital warts, but mostly today I want to focus on cervical cancer. So how do you present? Women, they tend to have intermenstrual bleed and also pain, or maybe actually not painful bleeding post-sexual activity, painful thigh, like on the back of your thigh, lower back pain, discharge, brownish discharge, bleeding, random bleeding, and like I said, there's intermenstrual bleeding, and this can actually even affect older women if they had Hpv infection. We do see people in their old age presenting in end-stage cervical cancer, so people need to screen. The most important thing is, if you are sexually active, protocols have changed globally. We used to start at 21, but now we say people at 25, they could just start doing their screening. So you just need 3 normal pap smears in 3 consecutive years, and then you switch to every 3 years. It means you could start at age 25, you start screening, and you do it at 26, at 27, and then afterwards you do it every 3 years, or as per your doctor's recommendation. The most important thing is be regular with your pap smears, and we also recommend people to do Hpv vaccination, the Gardasil 9, which would prevent you, or at least over 95% prevention from getting cervical cancer or genital warts. Now moving to, I'm not going to talk about management because it's going to be another detailed topic, but I mean, people, when they have cervical cancer, it depends on your stage. Mostly if it's an early stage, we do LEEP, which is a loop electrosurgical way of treating it, and then you just do follow-up on your pap smears by colposcopies till you are cleared by your oncologist, and sometimes you need total hysterectomy with the removal of your cervix. So like I said, it depends on the stage. Now moving to prostate cancer. Where I am in Canada, we say 1 in 9 men, they will have prostate cancer at some point in their lifetime. And believe it or not, over 2 million people actually are at risk because men do not come on time or do not screen for prostate cancer. So what are the symptoms, or who's at risk? Family history. Family history is always an issue. You don't choose your genes. So there's that family history risk. And obviously also when you're above 50, you do have a risk. Or maybe if you have other types of cancer, prostate cancer tends to be sisters with colon cancer, right? And of course, diet. High fat diet is dangerous to all of us, like high bad fats or animal fat. Basically, let me be more clear, is that risk, right? So how do you present when you have prostate cancer? A lot of times people present to us when there is bleeding in their urine. When they pee, there's frank hematuria, which is blood. Or sometimes when they go to pee, there's hesitancy, or there is frequency, and there's a little bit that's coming. And sometimes benign prostatic hypertrophy, which is enlargement of the prostate, which is not cancerous, could present similarly, but the only difference, there is no blood. So if you notice there's any change in your urination, or your dad has the similar symptoms, go see your doctor. We do a test called prostate specific antigen, and also prostate examination by doing direct rectal examination. That checks the size of your prostate, but otherwise PSA, the prostate specific antigen, is the most specific test we use. And obviously, if there's anything they've seen on the test, we always send you for further testing and referral to a urologist. Prostate cancer is one of those lucky cancers. If it's caught early, people get cured. And obviously, if it's caught late, unfortunately, you could have bone cancer, like it can metastasize to other parts of your body. So in essence, screening. I'm hoping everyone here, if you're above 50 or there's family history, go see your doctor, go get screened, be consistent, and live your life healthy. You take care.